This is a story of James Smith, the prison officer who was suffering with chronic pain in his heel. Now James walks a lot because of his job, and this was getting worse and worse, this pain, so he decided to visit the doctors. Now he'd been suffering with this pain before he came to me for approximately 18 months. But he'd gone to the doctors had sent him to see a podiatrist, and the podiatrist has said, yeah, you've got inflammation of the heel. What they told him to do was roll a ball under his foot to stretch out that plantar fascia sheath, to do some specific calf stretches to lengthen out the calves a bit. These were designed to take the pressure off the heel. A little bit of eccentric calf raiser work to strengthen the tendons up, and to do a little bit of icing on it. Time passed, and as time passed, the pain continued. It didn't get any better. Then a friend told him about Absolute Fitness, spoke to him a little bit on the phone, and he came in to see us. Whilst in to see us, we did a lifestyle analysis, so we looked at past history, injuries, that sort of nature. We did a postural assessment, and we did some palpation, and from this we take a holistic approach. We don't just look at where the pain is, we try to look at what could be potentially causing that pain. So, whilst palpating him, we found a tear. He'd already mentioned that he tore his calf about 10 years ago on the inside, the medial side of the leg. The podiatrist didn't seem too interested in knowing this information, but we certainly did. We also found 2 years ago that he sprained his ankle, so he damaged the ligaments, and it was quite a severe strain. This also meant that he'd stretched the peroneal tendons, which weakened that side, the outside, the lateral side of his leg, or the foot. This meant that because they were weak on the outside, and the calf was effectively tight because of this scar tissue on the inside, it caused his foot to supinate slightly. So he was putting excessive weight on the outside of his foot. This is what created the inflammation of the heel, because there was just too much pressure going through a specific point. Plantar fascia also was tightening up because of this, because it was trying to maintain the arch system. So there was a few things going on. So we put our treatment plan together, our route for success. Yes, we got him to use the ball because we wanted to ease the tension in that plantar fascia sheath, but we also got him doing some strengthening work. So we were trying to strengthen the peroneal muscles, which would help stop the foot supinating. So we've gone working with a rubber band under tension, so stretching the rubber band out, and then with the foot inwards to get him to turn the foot outwards. So he was curling the foot up to the side, so engaging those peroneal muscles. And we built the reps up. Started off just initially with 3 sets of 10, and then we took that up to 15 reps, then to 20 reps, then to 25 reps. Whilst in seeing us, which was generally every 2 weeks, we were into his calf and we were stripping out that scar tissue as best we could, which was quite painful for him, but no pain, no gain. And that eased the tension on the inside of the calf. They had him doing stretches. We were happy with the stretches, but not like that, not like they'd asked him to do it. So we'd adapted it. We didn't want to stretch the outside of the calf, but we did want to stretch the inside of the calf. So we'd adapted the stretch to ensure we hit the inside of the calf. We'd set up normally and then step across, driving that heel into the floor, ensuring that the inside of the calf got stretched. And we had him doing this daily. This meant that the inside calf got lengthened out. We strengthened up the peroneals on the outside, which helped return the foot to a neutral position again. Hence, taking the pressure off the outside of the foot, spreading the load on the foot as it should be, which meant we took the pain away and we got a happy client. So, if you want to know more about what we do, you can visit our website, www.absolutefitness.co.uk, or find us on Facebook if you haven't already done, at the House of Pain and Relief. And if you're interested, you can give us a call on 07766 384 341 and we'll take a look at you.